I don't have to show. Welcome to this first hearing of the House Committee on Health. I'm very honored to serve as your chair. And just for the record, today is Friday, January 30th. And it's 10:30, well now 10:31 a.m. in conference room 329. I'd like to welcome all of you to hopefully a productive session of 2026. And first of all, I'd like to introduce the House members. First of all, I'm Greg Takayama, I'm Chair of Health and proud to represent Pro City. And we have a couple of constituents in town in the audience. And Vice Chair, Kapu Liloy.
Kilo House District.
No, I'm just saying that most people don't realize that the vice chair of any committee is really the behind the scenes person who does lots of the legwork and actual handling of the bills and legislation before us. So appreciation to Vice Chair. And I'd especially like to welcome our brand new member of the House of Representatives, Representative Daisy Hartsfield, proudly representing Waipahu. And this is, I believe, her very first hearing of any committee in the legislature. So welcome. And of course, Representative Amado from Maui, and Representative Chair Martin, who is, Lisa Martin is Chair of the Human Services Committee as well. So thank you all, and the other committee members are monitoring us on TV, and will certainly show up in due time. Just a couple of housekeeping measures, not measures, but pointers. You'll notice that unlike last session, there are no microphones on the table. There actually are microphones in the room, and they're the green light things you see in the roof. So everyone can hear you. It's been tested, but our IT persons will focus the hearing. I don't think focus is the right word, but anyway, we'll concentrate the microphones on those who are speaking at the table or at the testifier podium. So we still need testifiers to speak from the podium. We also have members on testifiers on Zoom, like last year, and just pointers that we don't allow any trademark items on Zoom, and also ask you to stay muted until it's time for you to testify. And as all of you know, that we're all on YouTube, so we're being watched by a potentially worldwide audience, except Iran, I think, and some other countries. But anyway, so ask that all testifiers try and abide by a 2-minute time limit. We'll have a little timer behind us. And I'd also like to welcome Representative Alcos.
Hi, welcome guys. Good to see you.
First committee hearing. Thank you.
Right on.
So let's begin. And first up, let me explain that we'll take our agenda out of order because the second bill on the agenda, HB 469, relating to parking for disabled persons, we have a sign language interpreter with us for only a few precious minutes. So we want to take advantage of the presence to take the first bill 469 out of order. So let's begin. And 469 relates to parking placards for disabled persons. And first up, we have Christine Pagano from Disability and Communications Access Board. Welcome.
Aloha, everyone. Good morning. And thank you, Chair, so much, Takayama, for, and all of the members, your Vice Chair, and other members of this Health Committee. Thank you so much for the opportunity. So I'm part of the Disability Communication Access Board. I'd like to also add some explanations here regarding this bill. So, the placard is two-sided. and it's a hang tag. It's given to a person with a disability. And the person has a valid disability, and that placard is given to them to put in their car. Or any other kind of placard that they might be using. Anyway, they pay for their parking. The person who has a disability and who has that hang tag, there's two different types, and if they have either one of those, they need to provide proof. Sorry, just the interpreter's just making sure that that person can see the testimony. They need to provide proof that they're going to be traveling, and especially if they're going to be traveling from one island to another, or they're traveling within an island, or they're going to the continent. And so that disability, once that disability travel placard, if it is no longer valid, that makes it difficult for the individual. So we just want to make sure that we have this opportunity to be able to provide my testimony about the importance of this placard, the importance for this person, to be able to have one, and so that that's something they can use regularly. And if you have any other questions, you can certainly contact me.
Thank you very much. Next we have testimony from Office on Aging in support. Let's see, Daintree Bartolus, State Council on Developmental Disabilities. By the way, just for testifiers, it's actually better, you can sit up here if you like, but it's better to speak from the podium because then we get a better picture of you on YouTube. So please proceed.
Aloha, Chair, Vice Chair, and members of the committee. I'm Megan Han, interning for the Hawaii State Council on Developmental Disabilities in strong support for HB 469. I would like to emphasize the third paragraph of our testimony to elaborate on the fact that just like everyone, people with intellectual and developmental disabilities or IDD travel inter-island for medical care, especially for those that live on neighboring islands where treatment might be scarce. They have to make travel accommodations to arrive or park their cars at their respective airports, fly by plane, having to rent or get a taxi to get to their hospitals, and then they have to do that process all over again. Therefore, our council sees the benefit for this bill to reduce the stress and financial toll for individuals and families with IDD to get the necessary care that they need without the unnecessary hardships. And for any questions, I would like to defer those questions to the Disabilities and Communication Access Board, as they are the experts for this subject matter. Mahalo, and thank you for your time.
Thank you very much. And speaking of the Disability Communications Access Board, we have Brian Mick on Zoom.
Aloha, Chair. I'm DCAB staff. You've already heard from our executive director, so I'll defer her comments, but I'm here in case she needs me to respond to any questions about the parking program. Thank you.
Thank you. Let's see, we also have written testimony from the Hawaii Disability Rights Center, ARC of Maui County, and two individuals, Susan Davis and Leilani Kailiava. So is there anyone I missed who wishes to testify on House Bill 469? If not, members, questions?
Chair,
Yep,
I have a
President
question. I'm not sure if this question is for the board with Brian Mick, so whoever can answer. So I understand that this would assist with planned travel. Would this bill also assist with emergency types of travel? And if not, any suggestions on how we can include that as this bill moves forward?
So could you please repeat the question, and then I'll go ahead and try to respond to that.
Sure. So I understand this bill would assist with planned travel. But what about situations where it's an emergency travel and they aren't able to know what dates they're going to be traveling or how long they will be gone? Would this bill be able to cover that? And if not, what additional language may be needed as this bill moves forward?
Yes, I do understand that. Thank you so much. So yes, this is, and yes, it is handled by our Hawaii administrative rules.
Would an amendment to the administrative rules, would it be needed so that emergency types of travel would be covered? Or would this bill and the administrative rules be sufficient to take care of those types of circumstances?
Yeah, so this bill needs to have something like this bill is only focusing on travel. And yes, and then that will amend, then this bill will amend our Hawaii State administrative rules. And regarding travel. Right now, we don't have anything like this regarding travel in terms of the placards or the tags.
Okay, thank you.
Maybe you could stay up there because I have a question or two if I may. Now I understand these placards are important, right? I mean, everyone wants to have them available, which is why we're considering this bill. My question is, we also want to protect against misuse of the placards, right? So I want to make sure that if we issue these travel placards, that they're not misused by other people. So it's important, I think, to distinguish the regular handicap placard from the travel one. And so should we make it clear that the expiration date of the travel one should be clearly printed on the front side of the placard?
Yes. Yes, absolutely.
And
also,
okay.
The travel placard is related to the person who is going to be doing this. It's to their permit. It's not related to a family member. It's not to anyone who can ask to borrow it. It is the person who's permitted.
I understand. So to make it even more distinct, should we maybe issue the travel placard in a different color?
Yes, absolutely.
Okay. So I will make these recommendations when we consider the bill towards the end of the hearing. Thank you.
May I ask a question, Chair?
Yes, Representative Amato.
Thank you, Chair. Okay, so the blue placard is permanent. The red placard is a temporary disability placard. So if we do a different color for the travel placard, that will set it apart. So is there a standard across the country? Has this been done elsewhere where they have a travel placard?
No, there's no standard.
Oh, okay. Thank you.
All right, thank you very much. If there are no other questions, let's move on to the next bill, which is actually the first bill on the agenda, which is House Bill 218, relating to hospital surgical smoke. And first up, we have the Department of Health on Zoom, I believe.
Yes, good morning. Can you hear me okay?
Yes, we can. Please proceed.
Okay. Good morning, Chair, Vice Chair, and members of the committee. My name is Paula Serio, and I am the Chief for the Office of Healthcare Assurance for the Department of Health. The department stands on its testimony in support of HB 218. Thank you for this opportunity to testify.
Thank you. Do you have more to say in your testimony? Are you in support of the measure or?
Yes, we're in support of the measure and in support of HAH's amendments that they will propose when they testify.
Okay, thank you very much.
You're welcome.
Let's see, we have the Healthcare Association of Hawaii, Paige Choi. Is she on Zoom?
I am. Thank you, Chair. I'm sorry I couldn't make it in person.
Sure.
I'm Paige Choi, Vice President of Government Affairs for the Healthcare Association of Hawaii. We stand by our comments that we submitted asking for an amendment. We agree with the other testifiers that measures should be taken to ensure the safety of staff. As some of the other testifiers have noted, there are standards set out by entities such as the Joint Commission and NIOSH around surgical smoke that our hospitals are compliant with. But we do understand if the legislature chooses to make sure that there are policies around the use of surgical smoke, understanding that, of course, there is a spectrum of procedures that generate surgical smoke, and ensuring that hospitals do address those issues on a case-by-case basis in ensuring the safety of our providers. So thank you very much, and available for any questions.
Thank you. We have the Association of Peri-Operative Registered Nurses, Jennifer Pinnock. Is she on Zoom? No, but we have her written testimony in support, as well as testimony from Bernadette Ildefonso in support and Tammy Ueda in support. Have I missed anyone wishing to testify on House Bill 218? If not, questions, members?
Chair.
Yes, Representative Martin.
I have a question for Kate. So the language to me that your suggested amendment is a little confusing. Why wouldn't you leave in there to prevent exposure by using a smoke evacuation system as appropriate, and just have it all to specify that, and maybe even go into for the duration of the procedure or something. It seems like right now the situation is that an individual there on the ground gets to make the choice whether the room is equipped appropriately and whether that equipment is used. And so I think the point of the law is to make it less of an individual choice and have more set guidelines. So I don't know. It doesn't seem like this language achieves that goal.
Yeah, and I appreciate that. I think our hope with the language and what we were reading in the bill is, as you noted, to have more of a policy, right? Policies in place, standard policies in place, rather than leaving it up to individuals, which we acknowledge, right, I think is an issue that has come up in hospitals across the country, which is why I think AORN is really focused on getting this type of language passed in multiple states. I can bring that back. I can see if maintaining the current language is an issue. Where our members, I think, were coming from was that there's a wide range of procedures that generate surgical smoke. So, for example, in laparoscopic surgery, right, you're going to have a lot of smoke. You're going to be using electrical or cauterizing equipment, for the entire duration. But there are times where you may use a cautery for a few seconds, right? And I think the feeling was that if you had to use a smoke evacuation system, even for those few seconds of use of a cautery, it might not be clinically necessary. So our feeling was kind of keeping it flexible for those instances where there isn't necessarily a high risk of exposure. But as you noted, still maintaining a standard in terms of hospital policy instead of allowing it to be up to one individual. So we can take it back. If the committee would like us to reconsider the original language, we can. But that was the purpose of our suggestion, was to allow for that wider range of types of procedures and exposures.
Was that it? Do you have any other questions? Okay, if I could follow up with Chair Martin's question, how about if we changed your suggested language? In other words, keep what it currently says about using a smoke evacuation system, but adding in or other appropriate measure for each procedure. Would that be?
I think that could work. I can always bring it back, but I think that captures the essence of what we discussed.
Okay, we'll suggest that.
All right.
Sure, everyone can hold their breath.
Literally hold your breath. Okay, thank you. We have
Thank you.
humor on our phone. Thank you. Any other questions?
Chair,
Yes, Representative Akos.
hi. I just want to follow up on some of the questions as well. to the public, could you explain what is surgical smoke? Like what do you guys do on all that, where the smoke comes from?
Yeah, and my understanding of where the smoke is coming from, it's essentially whenever an electrical tool is used on tissue, and that will release some kind of smoke because there's liquid. I don't want to be too graphic, but essentially, right, when you're dealing with tissue, with other matter, if you use some kind of electrical equipment, usually to cauterize, then that's when that happens with the liquid in the body, that's where the smoke is generated.
When you guys do mostly surgery or some kind of thing that you guys need to work on the body, right?
Generally, yes, it would be a procedure that's happening in an operating room, which I would assume is largely surgery.
Thank you.
Yeah.
Thank you, Representative Marcos. A good point. I mean, smoke is kind of a misnomer because it's sort of vapor or some other
Right.
fumes, that could be used. Okay, any other questions? If not, let's move on to the next bill, which is House Bill 814 relating to an information campaign for young people regarding cannabis. And first up, we have the Department of the Attorney General, Michelle Nakata.
Good morning, Chair Takayama and members of the committee. I'm Michelle Nakata, Deputy Attorney General. The Department of the Attorney General provides the following comments on this bill. This bill appropriates funds to Department of Health to implement a public and informational campaign on cannabis. It also requires the department to administer grants to community-based organizations for services. Article 7, Section 4 of the state constitution provides that no grant of public money shall be made except pursuant to standards provided by law. If the intent of this bill is to procure prevention and treatment services by contracts, we have provided amended language in the bill. By contrast, if the intent is for the department to award grants to community-based organizations, we recommend that the bill be amended to include the appropriate grant standards. We have prepared draft grant standards for the committee's consideration, and we respectfully request that the bill be amended as recommended. Thank you.
Thank you very much. Next up, we have the Department of Health.
Good morning, Chair and Vice Chair, John Valera of the Alcohol and Drug Abuse Division. Providing comments. So we are the single state agency in the state that's responsible for promoting, coordinating, and delivery of care, both treatment, recovery, prevention, education, and such. We stand on our written remarks and also some amendments to the bill. We defer to the AG on implementation. We also we totally agree with the committee that cannabis use does affect the youth development, particularly in the area of the brain. So we launch a campaign. Continue to work with our partners. We will work with the other programs within the Department of Health to coordinate this public information campaign, as well as deliver service, treatment, and continue to, and the funds would definitely, if it becomes law, would definitely help expand our current service delivery. With that, thank you. I'm standing by for any questions.
Thank you very much. Let's see, we have written testimony from the Superintendent of Education and Support. Department of the City Prosecuting Attorney, Daniel Hugo. In support.
Hi, I'm
Oh, okay, you're not Daniel.
Hi, I'm Vinay McFarland on behalf of the Prosecutor Office for the City and County of Honolulu. And we are in support of House Bill 814. And good morning, Chair, Vice Chair, and members of the committee, excuse me. We are in support of House Bill 814. This bill is one that we can get behind because we have firsthand knowledge of the consequences of youth substance abuse in our communities. And any program that can get ahead of it and be proactive in helping keep our keeping youth out of our courtrooms is something that we can definitely stand behind. Because as we know, the legalization is happening countrywide and it's appearing as if it's okay to our youth to use this, not knowing the harm and the long-term effects of cannabis use. And so I think this campaign, I think it's gonna reach where it needs to be, and we are definitely in support of it. Thank you.
Thank you. Alan Johnson, Hawaii Substance Abuse Coalition.
Good morning, chairs and vice chairs, distinguished members. I'm Alan Johnson with the Hawaii Substance Abuse Coalition. We advocate for this increased funding for youth cannabis prevention and treatment. And we want to remind that prevention and treatment that are in this bill, they go together because they complement and reinforce each other as public health strategies. We see that cannabis policy is evolving, but we also see the public perception is still very mixed with more education need. Too many families and youth in Hawaii still think it's safe for their kids. It's not. Where our concern is that children are need to be protected from preventable harm. And we all know the kids' brains are adversely impacted and likely hurt for decades. But so many families, they don't understand that it's way, way more harmful to kids than it is to adults. Moderately for adults, but really, really hard on kids. And it's important that they learn that. And there's so much high potency. They're using vaping and edibles in schools. It's just really getting out of control. We see that happening everywhere. We do recognize that the rate overall is stable, but it became very high and then just stabilized. And there's a reason for that. You know, other states that legalized it, and as they legalized, the rate went up for use. And so there's new studies that are saying, yes, that cultural shift caused that. There was no direct correlation, that's true, but there was a cultural shift in thinking it's safe. Those states who legalized it then invested, the small states, $5 million to the big states, $15 million for a number of years, and they effectively brought down the use of informing the families. They brought significant decreases in kids' use. We are here at that juncture where it's not low, becoming high. We're already at the high level. A significant investment is shown in other states. It could bring that down. So it can work here. So we also have great treatment here, proven effectiveness with decades of science and infrastructure in place. We have a school-based program. I don't know if you're aware of that, but we are one of the top #1 states in the nation for treatment for adolescents. So in summary, I'm out of time. Prevention, reduces future need. Treatment addresses current harm. The funding we do have came from you folks. Thank you, thank you, thank you. We need a little bit more to keep up with the current times. Thank you.
Thank you, Mr. Johnson. Let's see, we have testimony from Big Island Substance Abuse Council in support. Brian Baker, Hina Malka.
Aloha, Chair Takayama, Vice Chair, and committee members. My name is Brian Baker, President and CEO of Hina Malka, and a member of the Hawaii Substance Abuse Coalition. As cannabis policies change, prevention and treatment must keep pace, especially for our youth. Today's cannabis is more potent, it's easier to conceal, and it is perceived as extremely low risk, even by as early as middle school children. Early and frequent use harms developing brains and increases the risk of anxiety, depression, addiction, and many other mental health concerns. We are also seeing right now more adolescents that cannot simply stop using cannabis. Cannabis use disorder is real, it is diagnosable, and it is treatable, but youth-specific prevention and treatment capacity has not kept up with the need. Investing in prevention and treatment is smart public health policy, and it is smart fiscal policy. It reduces long-term healthcare costs, improves school outcomes, and keeps our keiki connected to their families and community. We respectfully urge your support of HB 814. Mahalo.
Thank you. Let's see, we have written testimony from the Hawaii Family Forum, Eva Andrade in support. And just so the audience knows, I'm reading the testifier list in order in which we received testimony, so bear with us. Coalition for a Drug-Free Hawaii, in support. Bobby Benson Center, in support. Drug Policy Forum of Hawaii.
Good morning, Chair, Vice Chair, members. Dico Sleverins with the Drug Policy Forum of Hawaii. DPFH strongly supports science-based education and prevention programs regarding alcohol and other drugs for residents of all ages. Similarly, we support increasing this state's capacity to provide community behavioral health services for residents, all residents, regardless of insurance status. Substance use rates amongst the state's high school and middle school students indicate that the drug exceptionalism approach taken by this measure is under-inclusive. This approach does not reflect the gravity of harms caused by alcohol and nicotine products, including e-cigarettes and smoked tobacco that are more widely used. Excessive alcohol use, for example, is related to more than 200 diseases and conditions such as liver disease, cardiovascular disease, and cancer, and accounts for 178,000 annual deaths in the US and 600 annual deaths in Hawaii. Excessive alcohol use is also responsible for lost economic productivity of $937.4 million in Hawaii. Tobacco smoking remains the leading cause of preventable death in the US, with significant costs to systems of medical care, $611 million annually at the state level. Most of our US residents now live in a jurisdiction that has implemented adult use cannabis under state laws, and the experiences of those locales should help inform ongoing policy deliberations. And this includes the allocation of education, prevention, and treatment resources. States that dedicate a portion of tax revenues from adult use cannabis sales to support behavioral health treatment include Alaska, California, Connecticut, Illinois, Montana, New York, Oregon, and Virginia. Mahalo for the opportunity to provide testimony. Happy to be here.
Thank you very much. Let's see, we have testimony from several individuals offering support. We have Mary Elizabeth Pacheco on Zoom.
Good morning. Aloha Chair, Vice Chair, and members of our committee. My name is Mary Elizabeth Pacheco, and I am here in support, strong support of HB 814, which addresses both prevention and treatment for cannabis use and cannabis use disorder among Hawaii's youth. I come before you not just as an advocate, but as someone who witnesses every day how cannabis use affects our keiki, our ohana, our schools, and our communities. The data is clear and concerning. Hawaii's most recent youth substance use findings show that nearly 1 in 10 high school students, that's 9.5%, use cannabis alongside nicotine in the past 30 days. And 5%, which is 1 in 20, use cannabis along with alcohol and nicotine during the same period. These patterns are significantly more common among youth who report depression, highlighting the close connection between cannabis use and youth mental health. What's critical to understand is that this does not start in high school. Cannabis use often begins earlier, with vaping and experimentation emerging in middle school long before youth fully understand the risk to their developing brains and before families realize how quickly patterns can form. At first glance, these numbers may appear small, but each percentage point represents real keiki, real ohana, and real consequences. And without sustained investment in cannabis-specific prevention and youth-focused treatment, we don't have to imagine what happens next. We're beginning to see it. So to put this into context, this often looks like a middle school student who starts vaping THC because peers say it helps with stress or sleep. Over time, use becomes more frequent. So by high school, cannabis use may be daily. Sleep worsens, motivation drops, grade slips, and family conflict increases. So by the time help is sought, the youth is often struggling with anxiety or depression and feels overwhelmed and unsure how to stop. Clinically, we know that early and frequent cannabis use can impair memory, learning, motivation, as well as emotional regulation during critical stages of brain development. So for some youth, cannabis
Ms.
youth
Pacheco,
progresses.
I'm gonna ask you
Yes.
to please wrap up,
Okay.
if you would, thank you.
All right. So the bottom line is that this is not a problem for some committee. It is really shared kuleana, meaning I am in support of this, and I hope that you all will support this as well. Mahalo.
Thank you so much. Let's see, that's all the testimony we've received. Anyone else I missed who wishes to testify on HB 814? If not, and before we go to members' questions, I just want to mention that in case you're reading the bill, this bill is a carryover bill from last year. So references, in fact, all the bills on today's agenda are carryover bills. So if there are references to appropriations for that are out of step by 1 year, so we'll address that should the bill move forward. We'll take care of that in amendments. So members, any questions? Representative.
Thank you, Chair. Question for DOH, Health Department. The question, what is the Department of Health currently doing in public education? The bill talks about cannabis specifically, but in substance abuse and public outreach. What is your department doing currently in relating to public education on substance abuse, specifically to cannabis use?
We have some like social media posts that we put out, say in like January is Substance Use Treatment Month. There are substance use prevention months that we seriously intend to do more social media outreach. We are working with like one of the major media outlets to post, commercials and such, public service announcements. We also have, as part of our prevention contracts, some of them do media campaigns as well on their own. And we have a list of our prevention providers. So if you would like to
So
see
that's prevention contracts and providers. Is that in fulfillment of the Act 116 from 2018, which was passed? That was referenced in one of the testifiers here today. I think in that act from 2018 says that the health department is to provide science-based information in relation to medical cannabis in specific. So is your department currently fulfilling Act 116 in providing science-based information on medical cannabis to the public?
I'll have to check on that. It may be, because medical cannabis is regulated by another DOH program. And so I think they would be the lead for that.
Okay.
Yeah.
All right, thank you.
Okay, Representative Alves.
Hi.
With the increase of funds that you guys are requesting for, is it mostly going out to messaging again and committing awareness in helping our kids, or what are you gonna plan with the increase of funds?
So with the AG's amendments to change grants to contracts, we do have, the vast majority of the funds are going towards service delivery, treatment, recovery, as well as prevention. We are currently looking at developing what information campaigns we have dealing with cannabis use for young people, and then we are developing a similar campaign for the parents.
You said a little bit about recovery. Can you tell me a little bit more, what do you mean by recovery? How are you helping on recovery?
So we operate a clean and sober home registry, and so it's open to any home operator or owner who wishes to hold themselves out as a registered clean sober home. It's based on national standards from National Association of Recovery Residences, naronline.com. But we also, some of our providers that we work with regularly do have their own homes. And so, whether they need a home or whether they need outpatient, so recovery comes in many different forms, many different stories. So we try to work with what's best for the client and support, encourage our providers to do everything they can to support the client, whether they need a home or whether they need outpatient or other sorts of things.
Thank you.
Members, any other questions? Yeah, Representative.
Just following up a little bit on your Falco's question about treatment. When we talk about treatment that is specific only to marijuana use and not nicotine, not alcohol or these other things, what treatment is available? Is that just counseling? I mean,
So treatment includes a wide variety of services. There are about 2 or 3 dozen different services that a provider could give, from residential to
These are kids. They're probably not going into residential just because they smoke too much, right?
yeah. If it's specific to the bill, it's mainly, we're talking about intensive outpatient or outpatient services for like school-based youth or, so.
And what is that service? Is that counseling? I mean, you can't do a nicotine patch, or it's not like heroin where you can have substitutions. Like what is it? Just a counseling? I'm just trying to understand what treatment means.
It can be more counseling. I believe it includes groups as well, individual counseling.
Thank you. Thank you, Chair.
Thank you. Any other questions? If not, I have a question. In your testimony in the last paragraph, you mentioned that the department recently launched a statewide cannabis youth prevention campaign. How much money are you spending on this?
I have to get that for you, Chair. But we are working with the medical cannabis office on it, so.
Okay, and is this a ongoing program? Is it, just a temporary one, or is it multi-year in focus?
It's multi-year.
Okay.
Yes.
So
I believe we're in the second year.
You're in the second year.
Trying to, the first year they have a late start, so they don't really do much, other than getting the contract up. I mean, it was a late start getting the contract started, and so I believe we're in the second year.
So I'm just wondering if we're duplicating efforts by enacting this bill when you already have an existing public information campaign for youth.
So I think this bill would definitely supplement our efforts. If this bill passes, we supplement our existing efforts, to
Okay,
deal.
thank you. I'm going to ask the department if you could forward information about this ongoing current campaign to me, if you would.
Sure.
Thank you. Members, any other questions? If not,
One more, Chair, just
yes,
one more,
yes,
sorry.
sir. Go ahead.
How much more are you asking per year on the increase on this? You're not asking for?
So right now, based on we can work a plan out as to how much we need specifically.
Sorry,
because
just
this
for
is not
members' information, the amount proposed in the bill is $2 million for the information part of the campaign and $5 million for the actual treatment part of it.
Right, I seen some of that, but it was a little bit confusing on.
Okay. Representative Amano.
If I may please follow up on after the chair, to follow along the chair's questioning. Do you have any data supporting how effective your ad campaigns are? Do you have market data to see that you're actually reaching our students and our youth, that your campaigns are effective? Just want to make sure that this money is going to an effective campaign that's doing what it's supposed to do.
part of our existing campaign involves the expectation that these metrics will be covered. So, you know, depending upon where we are in the rollout, we will expect to have those metrics. I'm just not sure as to what phase, what stage. I believe we're in the beginning phase for the education to the website to reach the adolescents, the youth. You know, there is a similar thing in development to reach the parents, but the contract does specify metrics.
Thank you, Chair.
Sorry, Chair, thank you, Chair. For DOH, in terms of trying to educate students, does DOH have any collaboration with the Department of Education in terms of trying to reach students in school or trying to work together so that, you know, we know that at least students in public schools can get the information that DOH wants to share?
We can certainly reach out to them. I believe I have to get back with regarding whether we've worked with the DOE on this particular project. But definitely that dissemination is important.
Okay, thank you.
Thank you. Oh, and for members' information, I misspoke slightly. The amounts requested in the bill are $2 million for a public youth information campaign, $5 million for contracted prevention services, and $5 million for treatment.
That's what I was
So
doing.
12
Yeah.
altogether. Okay. Okay. Anyway, if not, let's move on. Oh,
Chair.
go ahead.
I apologize for jumping in this late. Department of Health. So I'm looking at the Clear the Haze campaign that you had noted in your testimony. It's fantastic that you guys have this resource available, and I wonder what it looks like in physical format. The website's nice. It definitely speaks to the youth. Since it seems like we're compounding this campaign with extra layers of support, one thing I'm very concerned about right now is other drugs, particularly things like fentanyl. So there are schools that have days called Fentanyl Fridays that are circulating amongst the youth. If we add more funding to a program for marijuana, which already has an established campaign that's running right now, are we doing something very similar for other common use drugs that are used amongst youth? In particular to things like fentanyl?
So we have, in terms of public education for other substances.
Just for youth in general, we'll take the education part out, just targeting youth of a certain age that would be more prone to using these substances in school, out of school, regardless.
I think we certainly can do that. The contract is more specific to cannabis use, but we'll work with our prevention team to get out.
Right, well, I'm just asking, do you guys have current campaigns out there to address more severe substances that are being used by youth right now? Because we have a marijuana one, it's fantastic, I see it. Do we have ones for things like the drugs that I described?
We do have a website for our Hawaii Overdose Initiative that has some stats describing the latest overdose data that we have. You know, in terms of something on the caliber of the Haze site, you know, I'll have to check. I know that we are working on it.
Thank you.
Thank you. Oh, okay, thank you. Any other questions? And just for members' information, we have a couple other measures that we'll be considering later this session regarding mental health services, specifically targeting youth. And certainly we can look at the language to see if they can encompass substance abuse as well as other mental health issues. So just for members' consideration. Okay, thank you. If no other questions, let's move on to House Bill 1452, adding advanced practice nurses to the list of health providers who can file birth certificates. First up, Department of Health.
Good morning, Chair, Vice Chair, members of the committee. It's a pleasure to be before the House Committee on Health, and we look forward to a productive session. My name is Lauren Kim. I'm the Planning and Policy Officer for the Department of Health, and as always, a proud resident of House District 34.
Thank you for coming from Pearl City.
The department supports this measure. This is consistent with over 15 years of public policy that, where appropriate, seeks to authorize APRNs to conduct healthcare transactions that were traditionally solely the realm of physicians. So this is very consistent with long-standing community standards of practice, and we support this bill as currently drafted. Thank you, and I'm available for questions.
Okay, thank you. Let's see, we have Sandy Harjo Livingston, Hawaii State LGBTQ plus Commission. On Zoom? Not present? Okay. Hawaii County Council District 2 Councilmember Kagiwara in support. Stonewall Caucus of the Democratic Party of Hawaii, Abby Simmons on Zoom. Please proceed.
Aloha, good morning, everybody. First of all, my name is Abby Simmons. I'm chair of Stonewall Caucus. My pronouns are she, her. I'm speaking in strong support of this bill. I think it's common sense, and it just extends the responsibilities of these transactions to APRNs. So we're not really changing any other legislation beside that. So it's a common sense bill, and we stand in strong support. Mahalo.
Thank you. Hawaii Health and Harm Reduction Center, Nikos Leverance.
Aloha, Chair, Vice Chair, members, Nikos Leverance with Hawaii Health and Harm Reduction Center in strong support of this bill. This bill is needed to expand the opportunities for trans persons to obtain birth certificates that comport with their gender identity. H3RC has APRNs on staff in our Kaka'ako clinic who serve members of our island's trans community. In contrast to developments on the continent, Hawaii should continue to ensure that trans persons and other sexual and gender minorities are able to access needed care and social services and also participate fully in civic and economic life. Mahalo for the opportunity to provide testimony.
Thank you. Let's see, I believe on Zoom we have Shonda Brack. Not present. Okay, let's see. I should note that we have written testimony from individuals. I counted about 3 dozen or closer to 40, in all of them in support of this measure. Have I missed anyone who wishes to testify on House Bill 1452?
Chair?
Yes, Mr. Galoyu.
Hello, aloha. Michael,
Please proceed. Yep.
Thank you. This is Michael Galoyu Jr. I'm president of Private Work Hawaii. We are here in strong support of this bill. I'm not going to belabor the issues that have already been brought up, but we do want to make sure that everybody knows that earlier this year, the Lemnick Institute has said that America is on the beginning of a genocidal process for our trans, mahu, and gender nonconforming individuals. The reason I bring this up is that this bill will help send a message to our mahu, transgender, and gender nonconforming Ohana members that they are part of this. We are going to lower the barriers for them to be able to get their foundational documents that they need. I just got back from a DC conference, and the fear is real out there with for our mahu, transgender, and non-gender conforming individuals when they travel, that if their documents don't match, that they could be denied access to airports, denied and be denied access to bathrooms. And so APRNs are the backbone of our healthcare industry. And without this modification, it will leave way too many of our individuals without ability to access this law that we already have on the book. So this is just common sense legislation, and we encourage you to pass it. Mahalo.
Thank you. Now, again, did I miss anyone else wishing to testify on this bill? If not, members, any questions?
Chair.
Representative Hawkins.
Hi, Director.
The Department of Health.
Department of Health. If this bill passed, how is it gonna protect parents' rights? What if a young children want to go and change their birth certificate, or how is it gonna identify who was that person at the time of birth?
So existing statute lays out procedures for the chain of custody of vital records, including sealing original birth certificates. So those procedures are not going to be affected by this. What's important, I think, to highlight here is that whether it be an APRN or a physician, that they have a bona fide provider-patient relationship, meaning that the APRN in this case knows the individual's medical history, has attended to this person, and is making the best clinical decision that they can make. So existing procedures have already been laid out. This simply adds the advanced practice registered nurses to those classes of providers who may document this record.
Thank you. A little bit confused. Maybe take it a little bit slower for me. So that child can change their birth certificate, or anyone who wants to change that gender, they may be able to if they accept as choices they want to, what you're saying, right?
So it requires a clinician, in this case a physician, and if enacted, an advanced practice registered nurse, to essentially corroborate the medical information. So what happens before that point is between the provider and the patient and the family.
And the parents has no control over that, and it would be if they're like 17 years old or 15 years old and want to do a change, and if the nurse or doctor says, I'm okay, you can do it, parents cannot control that.
Yeah, I'm unable to comment on that. This is, the department is a steward and a custodian of vital records. How it gets there, if there's a legal process or some other process, is outside the scope of our testimony, and that really is, I think you're getting at a family healthcare decision that the department does not get involved with. So once it gets to our doorstep and we see that it passes the legal requirements for us to go ahead and effectuate this change, we do so without necessarily understanding or having knowledge of the medical history before that. The
Last one.
of the APR is sufficient.
If an adult changes birth certificate, applies for a male or kind of female job that it would require more of a male or female, their birth certificate will qualify for who they are.
That gets more into employment law, and I'm not trying to evade the question, but that's really outside of the scope of the Department of Health. If a future employer requires a birth certificate as part of onboarding, that's a business decision of theirs. I'm not aware that that's the case. That's an area of employment law, I think, that I'm not prepared to testify on. That's not our expertise.
Sure.
Thank you.
Representative Garcia.
Same person, thank you. Question, so since your department does handle the dispensation and record keeping of vital records, currently, if a minor wants to change their gender on a birth certificate, does that require parental consent in or through your department?
My initial reaction is no, but
Does
I'm
it
going to
require
confirm.
parental consent?
I need to confirm that. If the request to amend a birth certificate shows up with corroborating documentation from a licensed healthcare provider, I believe that is all that is sufficient, but I need to confirm that, and I'll send that information to this committee.
For adults, it makes sense,
Yes.
their own whatever, but for minors, you would think for all government records, documents, changing things would require parental consent. So the fact that that isn't, I guess, certain on your part is actually quite alarming, but
well, that's my ignorance. I'm sorry. I'll need to look into that, and I'll get that information back to the committee.
Thank you.
Just for members, I just want to clarify that the sole difference in this bill is that it adds APRNs to the list of existing health providers. It doesn't make any other changes. to current procedures. Members, any other questions? Okay, if not, let's go on to the final bill on the agenda, which we saved close to lunch, and it deals with disposal of human remains. And it's House Bill 1481, and we have first up the Department of Health.
Morning, Lauren Kim, representing the Department of Health. The department supports this measure, and I'm available for questions. Thank you.
Thank you. I believe on Zoom we have Jay Morford, Hawaii Funeral and Cemetery Association.
Good morning, Chair Takayama. My name is Jay Morford. I'm representing the Hawaii Funeral and Cemetery Association today. We stand on our testimony of support for this measure, and I appreciate you hearing the bill. Thank you.
Thank you. Let's see, we have testimony from several other mortuaries here in town, all of them in support. Did I miss anyone else who wishes to testify either in person or in Zoom on this bill, HB 1481? If not, members' questions.
Chair, may I, I'm sorry, I neglected to share with the committee that we are suggesting amendments that changes the shall promulgate administrative rules to may. We can work out with industry the policies and procedures to effectuate this change without administrative rules. And if we are required to promulgate administrative rules, it may delay the administrative simplification that this measure is trying to achieve. So I'm sorry I forgot to highlight our amendment from shall to may. Thank you.
The all-important shall to may. Any other testifiers? If not, members' questions? Seeing none, if I could ask Mr. Morford a question. You know, this bill really originates from you folks. So could you perhaps, for the benefit of the members, explain why you are suggesting that the current law be amended?
Sure, I'd be happy to. Currently in the state of Hawaii under statute, we're required, if there is no direct written instruction from someone that's passed away, we're required to get all of next of kin's authorizations for any type of disposition, that would be burial or for cremation. That can cause us a lot of challenges when it comes to scheduling, especially when we're trying to coordinate with crematory to do the cremation, or we're trying to schedule burial at the cemeteries, Hawaii State, Punch Bowl, whatever cemetery entity we're looking at. What this will allow us to do is apply for the permit, give us 60 days from the date that we apply for the permit to continue through the authorization process with the families and coordinate scheduling with them, with the families that's more agreeable to them than possibly waiting when we have allotted time to be able to get the burial or the cremation scheduled. That's the intent behind the change.
Thank you. So as I understand it, you're still required to dispose of the body within 60 days as permitted. You simply remove the exact date on which within those 60 days the service or whatever ceremony
if we run into a situation where we cannot do a cremation or do an interment within that 60-day period, we would then be required to do an affidavit with the Department of Health to change the burial permit authorization time, which would restart the 60 days again. So yes, to answer your question, we're required to do it within the 60 days.
Okay, thank you. Any other questions, members? If not, let's move on to decision making. I think, do we need to recess? Okay. Let's go on. Hold on 1 second. Okay, so if we can move on to decision making, beginning with the first bill on the agenda, House Bill 218, relating to smoke procedures in hospitals. My suggestion is that we pass this as a House amendment, adopting the language from the Healthcare Association with suggestions that were provided by Chair Martin as well as myself. In other words, keep the existing language, which says hospitals shall adopt and implement policies to prevent exposure to surgical smoke by using a smoke evacuation system, and adding this language or other appropriate measure for each procedure that generates surgical smoke. That's my suggestion. Oh, and also add a defective date. We are gonna adopt a defective date of July 1, 3000. Just for members, for audience information, we add a defective date to indicate in the bill that the work on this bill is not complete. So that's why it's called a defective date. So members, any questions, concerns, or comments? If not, Vice Chair for the vote.
Thank you, Chair. Recommendation voting on House Bill 218. Chair's recommendation is to pass with amendments. Chair votes aye. Vice Chair votes aye. Rep. Amato.
Aye.
Rep. Hartsfield.
Aye.
Rep. Martin.
Aye.
Rep. Olds.
Aye.
Rep. Takano-uchi is absent.
Oh, she,
Sorry.
she's short.
Votes aye. Thanks. Rep. Alcos.
Aye.
Rep. Garcia.
Aye.
Thank you, members. Chair, your recommendation is adopted.
Thank you. This next bill is HB 469 relating to parking placards for disabled persons. My suggestion is that we adopt this as a House draft, adding the suggested language from the Disability and Communication Access Board, which provides a definition of disability travel placard. We also might want to make it clear that in the definition, the disability travel placard should have the expiration date clearly printed on the front side, and as well should, to the extent possible, be a different color from the current placards, non-travel placards. And also add a defective date. Any questions, comments, or concerns? If not, Vice Chair.
Thank you. Thank you, Chair. Members, voting on House Bill 469, Chair's recommendation is to pass with amendments. Any members voting no? With reservations, Chair, your recommendation is adopted.
Thank you. For this next bill, HB 814 relating to cannabis. I have a couple suggestions to be included as a House draft. Number one, shorten the preamble, but keep the essential meaning and intent. Second, adopt the AG's recommendation to change use of the word grants to contracts instead, to simplify the process. We also want to have separate sections for each of the contract campaigns to specify what they should include. Also update, well, as far as the appropriations that are recommended, make them clear that it's only for FY 27, and the figures would be $2 million for an informational campaign aimed at youth, $5 million for prevention, and $5 million for treatment services. Finally, add a defective date, and I think that's it. Members, any questions, comments, concerns?
Just
Chair Martin?
clarifying on the budget, so it's 2 million for prevention campaign and then
$2 million for informational campaign, $5 million for prevention, $5 million for treatment.
Thank you.
Beginning with Representative Alcos and then Representative Garcia.
Sure, I like the idea that we're helping out the youth and trying to figure out what ways we can do it. I don't like the where our plan is in marketing with them or trying to, I want to see more help. And I feel that we're losing the battle against cannabis and our kids. I want to see more effective ways that we can support and help them. I want to go reservations just because I feel that we need a stronger system. Thank you.
If I could comment, I agree that we're losing the battle, but it's my concern that we're not even putting up a fight. So
Understand.
that's the intent behind it. Representative Hartson.
Thank you, Chair. I also appreciate the intent of the bill as well as the spirit of it. I have some reservations in terms of the amount of money that's appropriated because I don't feel comfortable that there is a clear plan on how that money would be spent. And so that's the only reservation that I have at this point.
Thank you very much. And just a reminder that this bill does move on to finance afterwards. So. Any other comments, questions, or concerns? If not, Vice Chair.
Thank you, Chair. Members, voting on House Bill 814, Chair's recommendation is to pass with amendments, noting reservations from Representative Hartsfield and Representative Alcos. Any other members with reservations?
Reservations.
Thank you.
Reservations.
Thank you. Any voting no? Thank you, Chair. Your recommendation is adopted.
Okay, thank you. This next bill, HB 1452 relating to birth certificates. My recommendation is that we move this forward as a House draft, effecting the date. Questions, comments, or concerns? If not, Vice Chair.
Thank you, Chair. Members, voting on House Bill 1452, Chair's recommendation is to pass with amendments. Any members voting with reservations? Any members voting no?
No vote.
No vote.
Thank you, members. Chair, your recommendation is adopted.
Thank you. The final bill is House Bill 1481, disposal of remains. My suggestion as we move this forward as a House draft, adopting the DOH suggestion that we change shall to may to enable them to make the change under existing rules. Questions, and effecting the effective date. Questions, comments, concerns? If not, Vice Chair.
Thank you, Chair. Members, voting on House Bill 1481, Chair's recommendation is to pass with amendments. Any members voting with reservations?
Ready reservations.
Thank you, member. Any voting no? Thank you, members. Chair, your recommendation is adopted.
Thank you all. We're adjourned.